want to talk to you about a very common problem that is being seen increasingly in children, and that is the problem of constipation. First of all, we have to define what is constipation. Constipation essentially implies the passage of hard stools, or if the child does not pass stools for a day or so, or if the child strains and has difficulty in passing stools. All of these conditions come under the definition of constipation. Constipation is now, as I said, pretty common, and it is a cause of recurrent abdominal pain, and it also causes a lot of difficulty in feeding the child. Some of the causes of constipation may have a deeper surgical problem. So it is very important for all of us to be aware of constipation and to see a doctor at the earliest and treat it appropriately. The most common cause of constipation is unknown, that is idiopathic. So basically there isn't anything wrong with the child, but a combination of maybe a poor diet or some other events have led to constipation. Now once the stools become hard and the child has difficulty in passing stools, it is fairly normal for the child, especially if the child is small, to postpone passing stools, which makes the stools even harder, thus worsening the constipation. One of the things that we see very commonly in children with constipation is that they withhold passing stools. So they will run to a corner of the room and they will cross their legs so as to try and prevent passing stools. A lot of people think that it is the child trying to get rid of stools at that point of time, but it is actually a withholding behavior. There's also sometimes a cut in the anal canal of the child while passing stools, which are hard, and this can cause bleeding from that area. That also worries a lot of parents. If a child has any of these symptoms, the child should be brought to a doctor, typically a pediatrician initially, or to a pediatric surgeon, who will then assess the child and try and figure out if there is an underlying deeper problem. If there isn't any other problem and the child's constipation is deemed to be idiopathic, then the treatment is relatively straightforward with medications. However, it is very important to remember that the medication needs to continue for a fairly long period of time, and it should not be started and stopped abruptly. So your doctor will eventually tell you how long the medication needs to continue and may ask you to do certain other things, for example toilet training, increasing the fiber in the diet, and to apply some local ointments to allow your child to have an easier time to pass stools. If there is, during the course of testing, an underlying disorder that is found, then you would likely that the child will be referred to a surgeon who will then undertake the patient's care and do what is necessary. Remember, constipation can be a very frightening thing for a child, and it is also very important for us to try and sort out the problem of constipation early to prevent later issues in life. Thank you.